Hello, everyone. Thank you for joining us for our Connected Care podcast. My name is Ashley. I will be your host. I am a medical science liaison with the medical affairs team with Baxter. I am also a perioperative nurse by trade. And our goal with this podcast is to discuss the research and the impact of healthcare's most innovative minds. So it's perfect that we get a chance to start with AORN, who is a true industry pioneer. And today here we have Dr. Lisa Spruce, who is a Senior Director of Evidence-Based Perioperative Practice. And we also have Mindy Whalen, who is a Senior Director of Education and Live Events. So thank you again for joining us. I'm very excited to have this conversation. And before we get started, I know we are in the middle of the AORN conference this year. So how is everything going so far?
It is great and very, very busy.
Very busy. Yes, I am sure.
Absolutely. Sessions are packed. Yes. There's a ton of great energy, and it's a beautiful convention center here in Boston. So
perfect. Yes, we are in lovely Boston right now. So just before we get started, I just want to know a little bit more about both of you and how you've really come into this stage in your career. What made you start working with AORN? We'll start with Lisa.
I'm really happy to be here, so thank you for having me. I've always been in clinical practice, so I've been an advanced practice nurse, a nurse practitioner, and a clinical nurse specialist. And I got my doctorate in nursing practice, and the opportunity came open to come to work for AORN and direct the team of nurses that writes our guidelines. So I jumped on that opportunity and moved to Denver, where AORN is headquartered, and I have been there for 13 years.
Nice, very nice. Thank you. And Mindy?
Yeah. So I am the Senior Director of the Fiedler Education Division at AORN, and so I oversee all of our continuing education that's sponsored by medical device industry partners such as Baxter. It can be in a variety of different formats. It can be a live face-to-face event. It can be online programs. And a little bit about my background. I am a nurse by background. I have a master's degree in healthcare leadership and administration with an education focus. And I was a clinical nurse for a number of years in critical care and emergency nursing. But my love is clinical education. So I kind of came about to AORN in a roundabout way. I was actually hired when Fiedler Education was a subsidiary of AORN, and just hired as a clinical program manager, and I've been with AORN now for 9 years.
Nice, very nice. So you both have some great experience. So looking forward to hear more about what we have to talk about today. So we're going to have two different segments. The first, we'll talk with Lisa more about AORN and how they really use research and how that impacts their guidelines. And also with Mindy, we're going to talk more about just different partnerships with the industry and how AORN uses those partnerships. So we'll go ahead and get started. So for Lisa, my first question to you is, what is the mission of AORN and how does research fit into that mission?
Yeah, well, I'm going to read you the mission so I get it exactly right. So AORN defines, supports, and advocates for patient and staff safety through exemplary practice in all phases of perioperative nursing care using evidence-based guidelines, continuing education, and clinical practice resources. And we provide indispensable evidence-based resources to establish the standards of excellence for each phase of perioperative nursing care to achieve optimal outcomes for every patient, every time. And research fits into that because it is so important that in all that we do, in all our practices and our guidelines and the education content that we provide, that it is based in the best available evidence. So it's research supported, because we want to give our patients the highest quality of care based on the things that we know that work.
And really using that research to drive those different patient outcomes and the best patient outcomes.
Yeah.
Perfect. So the next question is, how can you describe any recent AORN nursing research priorities that are being focused on by the organization, and why are these important to perioperative nurses?
So we have an AORN Nursing Research Committee, and they set our research priorities, and they can be found on our website and on the research page. And there's right now we have 2 priorities, and I'm going to read these so we don't get them wrong. Priority 1 states to build the science of perioperative nursing practice through the discovery and translation of evidence-based strategies in the clinical setting. And priority 2 is to examine and link quality perioperative indicators to promote positive patient outcomes through evidence-based practices. And I think these are important to perioperative nurses because they serve as a pathway for their research projects. And there's also on the website where these priorities are, there's a whole lot of information about each one. So if a researcher is interested in going to see what those are, they can read about them and all the details that we provide. We update those every 5 years. Okay. So whatever nursing research committee is going on at the time, they will look at them and they will update them. Yeah. And so they're just great. They're great resources, and they're great for nurses doing research and also those doing evidence-based practice projects.
So having that committee, does it make it easier to identify those gaps in research and really help to give some direction on what gaps need to be filled with research?
Yeah, that committee does a great job. They are from different facilities, hospitals, academic medical centers. So they sort of have a diverse group. They can sort of talk about, well, here's what we're seeing, and here's what we think that would be, we should focus on as AORN. And so they give us a great idea of what's needed in practice setting.
Right. And seeing what is happening in the field and what's needed for those perioperative settings. Perfect. Very nice. Next question is, how does AORN contribute to evidence-based practice in the perioperative nursing, and how are the research findings integrated into those guidelines?
Yeah, so I think the biggest way we contribute, number 1, is through our evidence-based practice guidelines. We conduct systematic reviews. There are 8 guideline authors, and all are certified in evidence-based practice. And so once we conduct a systematic review and we get the evidence that supports a particular topic, we synthesize that evidence, and then we put out our practice recommendations. I think that's probably the biggest thing we do. But we also have our own evidence-based practice model that we have created, and we're very proud of. And it's on our website, and we allow perioperative nurses or anybody, you don't even have to be a member of AORN, to access the model and use it in their own evidence-based practice projects. And it includes our appraisal tools. So they can use those to appraise the evidence that they're looking at. Right. And then they're able to sort of see, well, what is the evidence telling me that I should make a practice change at my facility? Right. So there's some great tools out there.
Yeah. So it's a lot of work that goes into building these guidelines and really making sure that the latest evidence-based research is being utilized, and then trying to get it into practice as well.
Yes.
So that's a good segue into how does AORN ensure that the guidelines stay relevant and that they are introduced into nursing practice?
We have a great way of doing that. So we have a guideline advisory board, and on that advisory board, we have 8 AORN nurse members who really give us an idea of what are the problems they're facing in their practice settings. What are their ideas of what do they need guidance on? What would they like to hear from us? And then we have members of other organizations that contribute. And I'm going to read these because they're really important that we have these liaisons that help us. And they are from the American Association of Nurse Anesthesiology, the American College of Surgeons, the American Society of Anesthesiologists, the Association for Professionals in Infection Control and Epidemiology, the Healthcare Sterile Processing Association, the Society for Healthcare Epidemiology of America, and the Surgical Infection Society. So we collaborate with them to discuss what are they seeing. So what are all these organizations seeing from their members that are concerns or practice priorities, and then, what do they think? Or are there guidelines they'd like to see us create? And that is how we ended up with our new Enhanced Recovery After Surgery guideline. that we just published in November. And it was from that collaboration where we were seeing, we really ought to bring this guideline to our nurses and our perioperative teams because it has such a strong impact on patient outcomes.
Yeah. So that's great to hear that collaboration is something that's done on this side of things as well. We know in the operating room that collaboration is very important for the interdisciplinary teams to be able to work together. So it makes sense on this side of things that you focus on what are they seeing as well in their associations and kind of bringing it all together so that, we're all on one accord, and everyone wants the best for the patient. So
right. It's a beautiful thing.
It is. It all just comes together and works like a nice puzzle, and it I think really helps our perioperative nurses and to see that, these aren't just for you, but it's something that's recognized across the board, in different specialties with anesthesia, your surgeons and everything. That's really nice. I love that. Yeah. Very nice. So how are different types of research methods, such as you have qualitative, quantitative, or even a mixed methods, how are they most commonly used in AORN's guidelines?
Yeah. So we have a clinical research librarian, which is a great resource that conducts our searches. And like I said, we do systematic reviews. And we will get thousands and thousands of articles that we actually have to sift through and read. We take it all. It doesn't matter. We take the expert opinions, we take the qualitative, we take the quantitative, we take the everything. Now, we'd rather have randomized control trials. Yeah. We'd rather have systematic reviews with meta-analysis on every topic, but we don't. Right. And when we don't, we take all the other levels of evidence, and sometimes it may not be this is the definitive thing, but it tells us a story, and it gives us an idea of, how can we use this to make a recommendation in practice when we don't have those strong levels of evidence. So we look at all of it.
Yeah. And it's nice to have that comprehensive vision on what's going on, in the field, and being able to have those different ideas. Yeah. And so finally, just to wrap this portion up, I just have one last question. What are some barriers to translating the evidence-based guidelines into actual practice? How do we know all this hard work you guys are doing, how is it being translated into practice and really being disseminated?
Yeah. Well, I think there are a lot of facilities who make quality improvement, culture of safety a priority. And those that do, they don't have any issues implementing guidelines into practice. Right. But we also know that there are facilities that have lack of resources. They have lack of time. They don't have mentors that they need to mentor people into implementing evidence-based practice projects. Perhaps they don't have a leadership that has time to devote to it. So we know there are barriers. Right. So we have created implementation tools that we call our guideline essentials. And it is a suite of tools that will help them to, people that especially don't have the resources and they don't have the time, it will help them to implement the guidelines. So it is great, and it is available to all members. They don't have to have access to the guidelines to get those resources, and they're fantastic. Yeah. And we even include like a gap analysis to sort of show where are your gaps, what do you need to focus on? Right. And we have all kinds of education tools and policies and competencies. Yeah. So we make it very easy for them to implement the guidelines.
Yeah, I think that's great because you do have your range of different types of facilities. You may have your level 1 trauma magnet teaching hospital, where they're very rigorous about keeping those guidelines. And then you may have your smaller rural hospital, but having that gap analysis tool really can help them customize, how can they integrate these guidelines. Yeah,
it's so helpful facility. For them.
Yeah, definitely. Well, thank you for those answers.
Sure.
Appreciate it. And Mindy, now we'll get started with your section. Thank you so much. So now we're going to, again, get into industry partnerships and really how AORN works with industry partners. So the first question for you, Mindy, is how do partnerships with industry help AORN address critical issues related to patient safety and quality of care in the operating room?
Yeah, I think one of the great things with partnerships between AORN and our industry partners is we're all on the same team. We're all working towards the same mission, which is patient and staff safety. So, that's one of I think the most important things is that we have a reciprocal relationship whereby, AORN supports industry in getting messages out that promote staff and patient safety, and then industry helps with getting with helping sponsor education and other activities for our members.
Yeah. So trying to spread that word and really get that, once again, another collaboration opportunity, using teams coming together and really trying to help get that same goal accomplished. Like you said, focusing on patient outcomes and the best patient outcomes. Perfect. How do key industry partnerships with AORN help to support perioperative nursing in particular?
Yeah, absolutely. So anytime industry is sponsoring continuing education, which is where we see a lot of our partnerships around industry education, we see partnerships around market research opportunities whereby nurses can give industry feedback on new products and services. And it could be anything from a, basic concept to a fully built out prototype where, nurses can really say, like, as the end user, here's what I think would be beneficial, maybe make a couple tweaks here. So really, AORN brings industry and the periop community together.
Yeah.
And I think that's just critically important because, like with what you were talking about with Lisa, like we practice in a team, and industry is part of that team because you guys make the products and services that we need to deliver our best care.
Definitely, yeah. And we know that education, not only for staff, but just across the board, it's very important.
It is.
Because awareness around different issues, that's really how you address them, is just by having that awareness,
Absolutely.
Sometimes. So perfect. What criteria does AORN look for when establishing partnerships with the industry?
Sure. I mean, we definitely look for criteria of industry partners whose mission aligns with ours.
Definitely.
Because, at the end of the day, like I said, we're all on the same team. We're all there for the patient. And that's really probably our biggest criteria is just, making sure that products, we don't ever endorse a product, but if we're partnering with an industry partner, it has to be around a common goal of education, awareness, those types of things.
Right, having that alignment, very important, definitely. How does AORN collaborate with industry partners to ensure research findings are translated into real-world solutions for perioperative nurses?
Yeah, one of the things that Lisa, with her guidelines team, they put everything out for public comment. And so we also invite our industry partners as part of that public commenting period to, really say, I don't know that I agree with this, or, and then Lisa's team could actually go back and say, okay, well, here's what the evidence says. Here's, why there is a recommendation or is not a recommendation based on what the evidence says. So I think that's a really important way that industry works with AORN.
Yeah, and I think having that public forum where people can have input, you get input from all different regions too, which we know everything may not be the same priority based on where people are, but being able to have that input, I think, gives you a broader idea of, what are people seeing even in different locations. So that's awesome. How does AORN communicate gaps in evidence to the industry?
Yeah, I think public comment kind of is another way that can come about. Our market research division is another area where we can see what is really happening in practice versus what do we think is happening.
Right.
We also run several advisory boards that really do help us get kind of a pulse on what's happening in the periop community just on a day-to-day basis. So we've got a lot of different ways that we can kind of communicate what we're seeing on our end. And then conversely, we love to hear what industry is seeing because you guys are the ones that, do hear firsthand in the field more than we do. We know some of the challenges that your reps have every day in the OR. And so really just, we try to bring it together to come up with solutions.
Yeah, so getting those insights from both industry and from your perioperative nurses and things. So when you say advisory boards, who do you normally involved in the advisory boards? Are they AORN members or?
Generally. And it really depends on the different type of advisory board. Some want, like the educator and the staff nurse level. Right. Others want more of director, VP and above type of level because they bring such drastically different perspectives.
Definitely, yeah. And sometimes different priorities, depending on, if you're in the C-suite versus you're the boots on the ground, you have a different perspective for the
100%.
day-to-day operations
100%.
of that operating room. So definitely, that's awesome. Once again, collaboration, being able to bring together different stories to really have the same goal, like you said. Yeah, we all have the same goal. And how do industry partners and AORN collaborate to create education?
A lot of times around our continuing education offerings, industry will give us a grant to create an educational program based on, a topic that's resonates with perioperative nurses as well as the industry partner, usually around a patient quality and safety initiative. Mm-hmm. And this is actually where Lisa's team and my team work together a lot, where we do, we create an outline that's all unbiased and evidence-based. Generally that aligns with the guidelines if it's a perioperative topic. And so we go through, do a literature search, similar, not nearly as intensive as Lisa's team, but a mini literature search, and then make sure that the education does not reference any specific product, but really is focused on the science and the evidence behind the issue.
Exactly, yeah. And I think that's important for us too in the medical affairs side of things, that we're non-biased. And I think having that non-biased non-promotional side of the education, it allows people to really believe in what is being brought to the table, and not saying, oh, you're saying this works because you have an ulterior motive or, whatever the case may be. But that unbiased opinion is very important, I think, in education. So it's something that we really abide by as well.
And I have a team of 2 master's prepared nurses who, do review and make sure this seems like it could be a little promotional. So let's make sure we're focusing on the evidence so that they really give it that clinical eye and make sure that it's that unbiased content.
Yeah, so it's like having those checks and balances.
Fair and balanced.
Yeah, exactly, exactly. So the last question for you, Mindy, is in what ways can AORN and industry partners strengthen collaboration to improve patient outcomes and safety in the operating room?
I think, just continuing to participate in public commenting, continuing to have these, kinds of meetings where we talk about what are the initiatives that industry is looking to do? What are we hearing as AORN as far as issues go in the workplace? And just like I said, keeping the lines of communication open.
Yeah. Communication, and another buzzword for today is going to be collaboration. Collaboration. And we see that once again in the ORs, in the research, in this side of things as well. So this has really been great. I really appreciate you both sitting and speaking with me. Any last words before we wrap up?
I don't think I have anything, but we really do love these opportunities to collaborate.
Yeah. That's awesome. Thank you both. Thank you so much. I appreciate it. And thank you all for joining us. And we'll see you on the next podcast.